He is President and Chief Executive Officer of Christian Healthcare Ministries. It's a Bible-based organization that enables thousands of Christians across the country to meet their health care costs. They currently serve over 41,000 members in all 50 states, $48 million annual budget, staff of 59 employees. In his role, Reverend Russell speaks in many churches, has appeared on Fox News, Huckabee, NBC's Dateline, PBS's Religion and Ethics, and so forth. Howard, we'd like to welcome you today and thank you for being with us on the Conservative Commander Radio Show.
Well, thank you very much, Sam. It's an honor to be with you. It's a privilege always to talk to people and to talk to the American public. And we're pleased to be able to talk about a topic that not only do we know about it, but we're actually doing something about it. So we are part of the solution to what is a problem and troublesome for America today.
And that is a switch. Most sit around and complain, but have very few solutions. And frankly, a lot of the governmental policies and laws are removing from us a lot of options that we once had. Certainly health care, which you're involved in, we all know from Obamacare perspective, has restricted and reduced the number of options for many, many people, and we all know about that. But I want to know a little bit about the Christian Health Care Ministries that you run. Tell me and our listeners just a little bit about what this is. How are you involving yourself in the health care debate, and what is it that you're really offering that is unique? Now, we'll get into some more details later, but in an overview, what's different about you, and what are you providing?
Okay, well, in 1981, a group of Christian men were standing around talking about how some of them didn't have insurance, didn't have provision for their health care costs should something happen, and they couldn't afford what was available necessarily. So they were talking and said, we found out when the Christian community knows about a problem, the Christian community always responds. Now, there are problems that the Christian community doesn't respond to, but it's only because they didn't know about it. So they began to think up the ideas, and they formed this group, and the people said, we'll be members, and every month we will get a newsletter which will tell us what's going on with our brothers and sisters. If some of the folk have medical bills that fit the criteria, and generally it's not the minor, teeny little medical bills like a bottle of aspirin or a prescription of something, but it's those medical bills like I had an appendectomy or I had to go to the doctor and it was a couple $1,000s, those things, and from there on upward. They said if we are able to know about it, this newsletter can tell us. And we can continue to help each other by informing each other. Once we know, we'll take the dollar amount each month of the bills that come in, divide it by the number of people. We'll send out the newsletter and say, this is how much you need to send this month, and it's going to help these people. And they send it, and the bills were paid. Well, as time went on, that's 33 years ago nearly, as time went on, it became so that the membership grew, and the medical bills grew. So they said, rather than having a different amount every month, let's do an average of what the amount of bills has been over the last 90 days, and we'll just have all of the members send that amount per month. Then after 90 days, we'll reevaluate it. Well, now it's gone on so that we now are pretty good at knowing how many medical bills are going to be sent to us. In the last 14 years, we've only had one increase in the monthly gift amount, and that was 5 years ago. So basically it's this. God's people, we make them aware of the medical needs. They pledge to send money each month. That money is used for those medical needs. Now, we keep our administrative costs very low. Last year was about 2.78% in administrative costs. So now if you take that model and go back 2,000 years and look at the book of Acts, chapters 2 and 4, the followers of Christ came out of Pentecost. They went to the streets of Jerusalem. They preached the gospel. Then as they preached, people became believers. Now, as they were believers, they became a group. The first recorded deed of that group of people was, it says, some who had property sold the property, brought the money to the feet of the apostles, who then determined the needs of the people and provided to the people with needs so that none amongst them had needs. We do that, except we do it focused only on the health care costs.
Okay, now I think that's very interesting. Howard Russell, President, Chief Executive Officer of Christian Healthcare Ministries. We're talking with you today on what you are providing as a ministry to help meet the needs of healthcare costs. And what you've laid out, as you said at the beginning, that Christian philosophy have always met the needs where they have existed when they have known about it. In fact, before there was ever anything called an insurance company, needs of people were met. What you're saying is you following effectively a model that was laid out way back in the time of Christ, but doing it on a larger scale and focusing on the issue of health care. Now, I think that's a significant thing. Now, let me ask you another question here. You are doing this as a model with Christian Healthcare Ministries. You are one organization. Are there other organizations out there that are also following the same or similar model?
Similar model. There are two others of significance. In 1993, we had a man who we call a salesman, a field representative. He was able to take our mailing list, and he went out and started one that's similar. That particular one has a lot of differences in the way they operate when we get to the details. Then there's in 1994, there was another one. There was an attorney who was able to acquire the mailing list, and he was able to somehow involve so that another one was started. So basically there are three of significance in size in America that I'm aware of.
Okay. All right. Let me get to. I have a lot of questions I want to get in here so our folks understand and get a really good grasp of what we're talking about here. So you're talking about providing assistance, a different mechanism, not insurance, but a way of sharing the cost by letting people know. But effectively, it can work the same way. You pay a certain amount in. It's not a premium, right? But it's a contribution more or less. In effect, what does the average person who becomes a member of or a part of Christian Healthcare Ministries, and when it comes to meeting their healthcare needs, how, in effect, does this really practically vary from or differ from an insurance company as we know it? What are the benefits or the downsides from how somebody would actually participate in that regard? Howard Russell, are you still there?
I actually was suddenly talking to some lady who I didn't know and she didn't know, and she said, well, I was talking to someone else. So
well, it was someone at the NSA, but let's not go there at the moment. I think let's get right in here. Let's go. I want to go a little further because in our last 10 minutes. But let's be clear on this one issue. You are existing, you and these two other companies that are providing the medical cost sharing, put it in that perspective.
Yeah.
Is that the terminology that you would use?
Yes, that's true.
Okay,
that's
medical cost sharing. That is operating in a climate where Obamacare is destroying most of everything that's out there. How is it, and under what provision, is this a continuing option under Obamacare? Is there an exemption in the bill? How does it apply, and how is what we're talking, what you're providing, how is it termed, and how is the exemption, or was the exemption granted under Obamacare? Let's put it that way.
Okay. The exemption was put in the bill that Senator Baucus wrote. So his staffers were the one who actually agreed to let it go in. If they wouldn't have agreed, it wouldn't have gone anywhere. But we talked to those folks. We had our members in Montana talking to his office and so on and so forth. But then the influence was, and actually Senator Grassley was helpful as well, but the influence was to say this is a program, this is a ministry, it's a practice of our religious faith, and it's working. And our members are taken care of. They have no complaints. And as the process went on, in the bill that the Senate created by Senator Baucus, we got put in that bill as an exemption, and this is the way it works. And it's on what's called H.R. 3590. It's page 128. It says there that, of course, in the bill, everyone has to do these things and not do these other things. But it says exempt from the requirements of the bill are members of a health cost sharing ministry. Number one, it has to be not.
Okay. So that was the exemption. You're a part of that. Max Bach helpful in getting that involved. All right. Now, that being the case, who can become a member of? Is it open to anybody? We have listeners who are on there. Some may find this to be something to solve something that they have right now and perplexed what to do. How do you
Right.
accept members, and what do they have to do to become a part of Christian Healthcare Ministries?
One of the requirements of the bill to satisfy the exemption is you have to be of like faith or ethics. So in our case, in Christian Healthcare Ministries case, if you are a Christian living by biblical principles, you sign your application to that effect, and you become a member. So in our case, it's those of the Christian faith who embrace that and sign saying they live that way. They become members. We also exclude tobacco use. So if someone is using tobacco, they'd have to quit using tobacco before they joined our ministry. But similar faith, like faith, and ethics. So in our case, they sign that application, they're a member. There's no health check, there's no other examination or anything.
So now, you're telling me that pre-existing conditions, which is a big issue, is not a prohibition for somebody considering. It's more of their profession, their belief system, their values that they're living by, including how they live, such as not smoking tobacco, which is obviously bad for your health, a few things of that type. That's really what you're talking about. Is there anything in the law that prevents another ministry? There's three that you're out there talking about does this now. Is there? I mean, could a fourth or a fifth one come about under the law?
There is in the law, another of the requirements is that the health cost sharing ministry has to have been in existence since December 31st, 1999, and they have to have shared medical bills of their members for consistently without interruption. So
well, that's interesting. That's interesting, Howard. Then, because really, again, I was in the Pennsylvania legislature for years, and we actually made some changes in Pennsylvania legislature law relative to what the Pennsylvania Insurance Department was attempting to do with the same kind of thing years ago. And it was how they looked at it. So I'm assuming, based on what you're saying, that those who crafted this looked back and said, you know, we don't want somebody trying to a Johnny-come-lately on-the-spot political decision to try and do a bit. But if you have evidence that you have believed something and it has worked and you've been already doing it, then we're going to grandfather you in, which effectively is what you're saying.
That's accurate, although a person can join our ministry now, even though they haven't been participating, but a new ministry cannot start on the basis of that law. We do know that there are some folk who have looked at this and they said, oh, this is a way to beat the law or this is a way to make money. And there's one that has started called Liberty that I happen to know that the some of the principals involved are looking at it that way and have actually committed fraud in their past life and been convicted of it. So we know that that can be a risk, and that's, I think, one of the reasons they put in the bill that it has to be a ministry that has proven itself, as opposed to someone jumping up like this other one has done. They've jumped up and they're saying we're going to do it too, but in fact their own personal history is suspect.
Okay, that's excellent. We have about 3 minutes left. Rick Trader, you're listening here as well. Do you happen to have anything that you want to jump in here in the last couple of minutes?
Yeah. What I wanted to know, Reverend, is about the mandate, the HHS mandate that requires people to cover things like abortion and birth control.
Correct.
Does this have any factor in what you're doing?
It does not have a factor because we are written into the law as an exemption. So in other words, our members are exempt from the requirements of the law. We are exempt from the requirements of the law in that light as well. So we are not impacted by that because we are exempt from the law.
Okay, and all the funds coming in are private donations?
They are. That's correct. They come from our members. And while we are a 501c3 and we have an annual audit, we have significant measures we go through to make sure that people are able to see transparently that we are doing exactly what we will say we'll do. I want to mention one quick thing about the pre-existing conditions. We are very open about pre-existing conditions. They come in and they get shared on the schedule. After 3 years, they're no longer pre-existing. Anything up for that 3 years is completely taken care of as well for our regular sharing program and the prayer page. So that's not true of the others that I'm aware of.
Okay. Another thing you mentioned with Sam, that if people are tobacco users, they either have to quit using tobacco or they can't become a member. Do you have the same kind of regulations for people who use alcohol or drugs?
They're not allowed to use drugs illegally, and they have to follow the biblical teaching on alcohol use. Someone asked me, what is that? I do know that the Scripture says, do not be drunk.
Do not be drunk.
So if someone is an alcoholic or they're drunk, then they have a problem with it. But if they quit that and they begin their journey stopping that, then we're right there for them.
And you also said that members must live a Christian life. So I imagine this would mean that couples must be married, legally married, and that this prohibits people who are gay from participating?
Well, this would prohibit people who are practicing sexual relations outside of the scriptural teaching. And
once again, before we wrap up today, could you give us websites where our listeners could go to?
Yes, the website is chministries.org. That's CH as in Christian Healthcare Ministries.org. And if they go to ChristianHealthcareMinistries.org, that goes to us as well. That's our site as well. But chministries.org. Then we have a toll-free number at 800-791-6225, 800-791-6225. The website, if they get there, the first thing on the first page is a video where Governor Huckabee interviewed me on his Fox News program. That is a perfect way to start because it introduces the ministry, and then the website is very thorough, comprehensive, and giving the information that's necessary for them. And we'd be honored to serve them because we are, in fact, serving the body of Christ. That's what we're here to do.
Well, Reverend Russell, I got to thank you for coming on today. One of the great things about doing this show is I learn an awful lot. And I'm
honored to be your teacher if I have helped you.
Well, yes, you have. And I think what you're doing is terrific. And, you know, it goes, I don't know, Sam, we got to wrap up in a minute. But, Sam, this goes, in my opinion, goes back to what I've been thinking for a long time. We don't need government to satisfy every little want and ill we have. That there are good people out there who will help others who are truly in need of that help.
Absolutely, Rick, and it's a biblical model, and this government, just allow it to happen, don't try to control it. These needs can be met. So, Howard, I really thank you for being with us today on the show, and we'll have to have you back sometime. We'll get a further update on how things are going, but thanks for the model and for the ministry that you're putting out there.
I'll tell you that I'm confident that God has provided this ministry, and He is the one who made the way to get in this bill. For all the things the bill is, we give God the glory and the praise. God has a history of providing for His children, and we believe this is as good an example as opening the Red Sea for them to cross, leaving Egypt.